Today we are going to discuss about the continuation of emulsions as a part 4. I'm Dr. Jeevanandam from Sri Shanmuga College of Pharmacy, Department of Pharmaceutics. So last few classes we have discussed about emulsions, introduction part, preparation methods, and what are all the identification test types of emulsion. As an extension, we are going to start today about instability of emulsions. So the flocculation, creaming, coalescence, breaking, and miscellaneous physico-chemical properties affect physical and chemical changes happening inside the emulsion, phase inversion. Few ideologies which is showing some changes in the emulsion preparation. It's named under the category of instability. So first you can see the overall pictograph which I have shown here. So you can see here coalescence. A good emulsion will be like this. A good dispersion will be there. So it was classified the instability problem into few types. That is one by one I have listed now. Just one is coalescence and flocculation and creaming effect, breaking effect. These are all due to the phase inversion principles, and the distribution of dispersion phase is not correct. This will be happening. Creaming effect, you can see the dispersion medium is there floating on the continuous medium like this. Breaking means completely detaching. Flocculation means it is like dotted particles, clumsy clustered particles will be joined, reform, and the uniformity will be disturbed in globule distribution. Coalescence means it comes together, the dispersion medium, and formed as a single droplet or bigger in size. The aggregation will be there. So this description has been given for flocculation, and what about the size distribution and how far the creaming effect is taken place. This all has shown in the description. Creaming is the concentration of globules at the top or bottom of the emulsion. Droplets larger than 1 mm may settle preferentially to the top or bottom based upon the gravitational forces. Creaming may also be observed on account of the difference of individual globules. It can be observed by a difference in color, shade, or layers, which I have shown in the pictogram, like the picture photo. It is reversible process. The cream can be redispersed easily by agitation. This is possible because the oil globules are still surrounded by the protective sheet of the emulsifier. Creaming results in a lack of uniformity of drug distribution. This leads to variable dosage. Therefore, the emulsion should be shaken thoroughly before use. So that is an precaution added in the label of the emulsion preparation. Use well or shake well before use. Creaming is of two types: the upward creaming and downward creaming. It was shown here in the picture. The upward creaming is due to the dispersed phase is less dense than the continuous phase. Downward creaming occurs, the dispersed phase is heavier than the continuous phase. So since the creaming involves the movement of globules in the emulsion, it can be applicable by the Stokes law. So that velocity is equal to diameter of the particle square into Pascal of the specific dispersion phase and dispersion medium which is used. G is nothing but the gravity force, acceleration gravity. Nu is nothing but the viscosity. So creaming is influenced by global size and viscosity of dispersion medium, difference in the density. So creaming can be reduced. How the creaming effect can be reduced means correctly maintaining the uniformity of the particle size used in the dispersion medium, or reducing the particle size by proper methods such as homogenization. Increasing the velocity of the external phase by adding thickening agent. Examples are tragacanth and sodium alginate. So reducing the difference in the density. between the dispersion phase and dispersion medium, adjusting the continuous phase and dispersion phase densities to the same value should eliminate the tendency to creep. To make densities equal, oil soluble substances such as bromoform or bromonaphthalene are added to the oil phase, rarely used techniques. Coalescence, as I said earlier, if the size of globules are not uniform, globules of smaller size occupies the space between the larger globule space. So, a few globules tend to fuse with each other and form bigger globules. So this type of closed packing induces greater cohesion, which leads to covalence. In this process, the emulsifier film around the particles are destroyed to a certain extent. This step can be increases the globule size and reduce the number of globules attaches. The coalescence is observed due to insufficient amount of emulsifying agent, altered partitioning of the emulsifying agent, incompatibilities between emulsifying agent. The phase volume ratio of a emulsion has a secondary influence on the stability of the product and represents the relative volume of water to oil in water type emulsion. So the higher ratio of oil to water, globules are closely packed, wherein small globules occupy the void space between bigger globules. So thus globules get compressed and become irregular in shape, which leads to fusion of adjacent globules. The Ostwald and others have shown that if one attempts to incorporate more than 74% of oil in an oil in water type emulsion, the oil globules often covalence and emulsion breaks. This value is known as critical point. So it's also defined as the concentration of dispersed phase above the emulsifying agent cannot produce a stable emulsion with desired type. Either it may be oil in water type or oil in water in oil type. So the next last one is breaking. Separation of internal phase from the external phase is called as breaking of emulsion. So this is indicated by complete separation of oil and aqueous phases in a irreversible process. That is, simple mixing fails. It is to resuspend the globules into an uniform emulsion. In breaking, the protective sheath around the globules is completely destroyed and oil tends to covalence. Phase inversion, the last type of instability problem. This principle work out in the concentration variation even. That involves the change of emulsion type from oil in water type to water in oil type or vice versa. That is reversible. When we intend to prepare one type of emulsion, say oil in water, and if the final emulsion turns out to be water in oil, it is termed as the sign of instability. Points to be considered during formulation of emulsions: stability of the active ingredient, stability of the excipient, visual appearance, color, odor, viscosity, extrudity, loss of water, and presence of volatile vehicle components, concentration of emulsifier, order of addition of ingredients, particle size, distribution of disposed phases. pH, temperature, type of equipment, method and rate of cooling, texture, feel upon application, microbial contamination, release, bioavailability, phase distribution, phase inversion should be focused. So quality control tests for emulsion. Main quality control tests are determination of particle size and particle count through optical microscopy. Anderson pipette, by using it we can go for sedimentation technique, and counter counter apparatus can be used. Determination of viscosity and identifying whether the flow property is based upon Newtonian law or non-Newtonian law using viscometers. Determination of phase separation. This is another parameter used for assessing the stability of formulation. Phase separation may be observed visually or by measuring the volume of the separated phases. Determination of electrophototypic property, determination of zeta potential, its quality test, and stability testing. The unstable nature, the rationale behind the instability, everything we have gone through. And as a final, we are discussing about stability of emulsion is important for the formulator because based upon the physicochemical parameters we have listed here, the following physical parameters are evaluated in the stress condition like phase separation, viscosity, electrophotic property, and particle size, particle count. Preservation of emulsion. It is necessary to preserve the emulsion from microorganisms which can proliferate easily in emulsified systems high water content. So particularly if carbohydrates or proteins or sterile materials are also present. Contamination due to microorganism can result in the problems such as color change, odor change, gas production, um, hydrolysis, and pH change, eventually breaking of emulsions. Therefore, it is necessary that emulsified systems be adequately preserved. An ideal preservative should be non-irritant, non-sensitizing, and non-toxic in the concentration used. And the impact of taste or color or odor of the product should be focused. It should be stable and effective over a wide range of pH in different temperature, and it should be have a wide spectrum of activity against a range of bacteria, yeast, molds. The selective preservative should have high water solubility and a low oil in water partition coefficient. It should have bactericidal rather than bacteriostatic effect. Examples of antimicrobial preservatives. I have listed here few derivatives. You can go through it. Preservation for what we are using to protect from oxidation reaction, how it is going to be protect because of different types of oils and waters are going to be mixed in different ratios. During that the rancidity may come, so that is called as oxidative changes. To avoid that and spoilage in the presence of environmental atmospheric oxygen should be avoided. For that, antioxidants are used here. In ideal, antioxidants used commonly um, in the emulsions for maintaining the stability to avoid the instability problems as listed here. Propyl glycate, butylated hydroxyzole, hydroxytoluene. These are all few preservatives used to avoid the oxidation reaction. And packaging, labeling, and storage of emulsions. Depending on the use, emulsion should be packed in a suitable container. Most probably, it's advisable for all the pharmaceutical products. Emulsions meant for oral use are usually packed in well-fitted bottles having a airtight closure. Light sensitive products are packed in amber color bottles. For viscous emulsion, wide mouth bottles should be used. The label on the emulsion should mention that these products have to shake thoroughly before use. External use product should clearly mention or their label that they are meant for external use only. Emulsion should be stored in a cool place, but refrigerated should be avoided at this low temperature can be an advantage and give a good effect for to maintain the stability of the product. So here today we have discussed part 4 video regarding the emulsions instability and how to avoid the instability things, and what are all the ideal properties to maintain the stability of the emulsion, and packaging advice, and what are all the basic preservatives are advised for the emulsions products. So thank you. We will meet in the other video. That will be the concluding video for the topic emulsion part 5. Thank you.